Hi, Dr. Pelto here. I've been having a lot of patients come in this time of the year with cold injuries to their toes. Now, very few of the patients come in with this advanced case. What you can see here in this picture, this initial one, is there's been skin changes. The skin looks a little bit darker, and there's areas of drainage in the nail edge. Now, this is a kind of a severe case of cold injury. And I want to just start out by a lot of patients say they're not exposed to the cold. Like no one thinks they get frostbite. But it's very, very common in New England this time of the year because people are going outside and they're being exposed, or even if they're inside and their toes can change color. So let's look a little bit about some of the less severe ways that cold injury can look. When we talk about cold injuries, there's a couple of names that come up. One is called chilblains, another one is pernio, another one is frostbite, and another one it's not specific to Raynaud's, but a lot of these patients have Raynaud's. So we'll start with the Raynaud's. So Raynaud's are these white patches that happen on the toes. It can happen on the toes. It can happen on the hands. This is quite common. I have this on my hand at times. This is more consistent with Raynaud's. Cold exposure causing the blood to drain out or vasoconstrict, which is the blood vessels kind of closing down, and then it causes issues. It can develop into chilblains or pernio, and these are more subtle changes. They tend to be on the tips of the fingers and the tips of the toes. This is what they look like in the toes. This picture down here, you can see that there's this like blister that started on this big toe. Here are red lines. This is the most common change we see is at the tip of the nail, it becomes red. Sometimes it gets blistered, sometimes it doesn't, but it's quite common this time of the year. What causes it? Extended exposure to cold or damp, wet situations. Let me give you a couple of examples. Let's say someone runs outside or is very active, their feet sweat, and then they stay outside, and then they're going to freeze or they're going to get really cold. Let's say they go out and plow the snow or the snow blow. They're going to get colder if they do hiking or walking outside. That's gonna cause it. Also, cold-induced vasoconstriction, which is where the blood vessel goes from being large to small, and then vasospasm, where they kind of spasm and they kind of tighten up. So these are all kind of the causes. And I want to be frank, some people aren't even out that far or out that long. Some patients just kind of sitting around at their house on the computer with their feet against the wall, and the wall is cold, and they're not wearing shoes, and their feet are getting cold, and they just think, oh, my feet are cold, and they're not moving around. They can also get these cold injuries. Here are a few examples from patients I want to show you. This is one that she only had this change on the second toe. You can see how it looks red. She was wondering what it was, and she thought maybe she had an infection. She thought maybe she had a blister. Another example of a patient at the tips of the toes. Now, when you look at them, they are going to start out bright red, and then as they get older, they're going to get a brown or a blackish color. So as they get older, they're going to look darker. They're going to start out, as you can see this example in the bottom right, they're going to start out bright red, and then they're going to get a little bit browner. Here's a couple of examples at the tips of the toes, front of the foot, big toes as well. These are all cold injuries. Now, who is affected by them? Usually it's young and middle-aged women. I tend to find that they're very slender. Some children, I don't see many children in the office though. I don't see many older adults. Usually it's middle-aged women. Low body mass, meaning they're skinny. I guess diabetics, theoretically. Those that have poor circulation, I guess you can see it. I don't see it. Most of the people I see are these middle-aged women. That's what I'm seeing. Another example, this is a very red one at the tips of the toes right here. And now these, you may ask, are they going to be painful? Yes, they're very painful. They hurt. And then as they feel better, they may hurt a little bit less, or they might start to get itchy as the skin kind of sloughs off. Here's an example of ones that developed blisters on the tips of the toes. There's going to be redness, red spots. There's going to be swelling, usually on the fingers and the toes. There's going to be blisters and maybe even wounds or ulcers. There's going to be tenderness and itching. Now, if an ulcer develops, don't do like I did recently. I tried to take off the blister. Just leave the blister. Leave it by itself. I thought it was going to make it feel better. It actually hurt more. Don't do anything to it. Leave the blister on. There's going to be tenderness and maybe itching. If there's itching, you can use a steroid cream. And now be careful, because once you have a cold injury, you're more intolerant to other exposures. And then there could be injury to the tissue, which is like the soft tissue with blistering, the nerves, the blood vessels, things like that. if you have a cold injury. Now, this is a very advanced form of it. I've never seen this in the office per se. These are just other pictures. This is an example of like trench foot, where it gets not only cold, but it gets very macerated and white. And then this is an example of frostbite, where it turns kind of blackish because it gets frozen. So how do you prevent? I'm going to talk about more about minor cold injuries. How do you treat it? Preventing would be preventing exposure, right? Exposure to the cold. It's going to usually resolve on its own. So in the summertime, you're going to be better off because it's going to go away. My wife, she has it, and in her toes, they kind of itch. In the shower, they get really, really warm. So just be aware, if you have it, the tips of your toes can get warm in the shower for the hot water, because it's the stark difference between the two. Keep your toes warm, maybe a second set of socks. You can do some toe warmers or hand warmers in your shoes. Stop smoking if you smoke. That's bad for it. A shorter dose of a steroid cream can be helpful to help with the itching. You want to prevent infection if there's any opening, so a triple antibiotic. I've never really used this, but I guess theoretically, if you have pain, you could do Voltaren or a lidoderm patch. If there's frostbite, you want to heat it up quickly. We're not going to kind of go into the details of that, but if it's really frozen, you have to heat it up quickly. If it's not frostbite, keep it dry, elevate, and rest. And then you have to keep hydrated, because many times you need the blood, the liquid, the flow in there. And then don't walk or rub the feet if there's a really bad blister, because it could cause that blister to come off. So those are some of the ways we treat minor cold injuries. If you have any questions, please put them underneath this video, and we will try to answer them. Okay, thanks.